Well, good day, everybody. We're here with Sally Jordan, who is the CEO of HealthPoint here in Northern Kentucky. Sally, thanks for coming with and chatting with me today. We just want to jump right in to you've got a great organization, been around a long time. You've now been CEO for about a year, been there for, I guess, over a decade or more, almost 12 years, I guess. What is HealthPoint and what is it? How is it providing healthcare to the community today?
So HealthPoint is a healthcare organization. We provide medical services, OB services, mental health services, and dental services.
And you've obviously tens of thousands of clients a day or a year, I should say. You actually, I understand, 35,000 individuals in a given year. Unlike ever before this pandemic that we're dealing with, you prior to this, you had people coming to you with all those services, but now you've got individuals who are maybe worried about their health, and we've been telling individuals. Don't go to the hospital, the emergency room. If make sure you call your primary health care, call your doctor, and some people don't have a doctor. Can they call you guys to do that, to get help?
Absolutely. We are here to be a solution for the community. So even if you are not a current patient of HealthPoint, even if you have no other medical provider, you can call us and we will help you. We are seeing patients same day through telehealth. And if a medical provider deems through your telehealth visit that you should be seen in person, then we will bring you in that same day to be seen.
And that's amazing, especially today, right? I mean, that's everybody's worried about getting out of their houses. You have a first route to be able to do telehealth, but if that's not the case, then in that situation, you're going to be able to connect them to the needed care, whatever that might be. Are you seeing the individuals maybe afraid of coming in? Do you get a sense of that?
We do. We are seeing people, there's a lot of fear. We are very proud of the Northern Kentucky communities because they are following the instructions of not leaving home when you don't have to. So for the most part, patients are following that and calling first. We have seen a decline in people wanting to seek care. And I think the biggest misunderstanding is in order for them to seek care, they think they have to come to an office, and that's just not the case. We're handling a very wide range of medical conditions over telehealth. So they don't have to skip medical services.
And that's regardless of the pandemic, right? You've got that ability with your docs and with your clinicians to be able to work with people like that today and see what their need is. And you're working hand in hand, I would assume, with St. Elizabeth.
Yes. We have a weekly call with the health department and St. Elizabeth. Been in contact with them early on, as well as other healthcare providers in the community and the health department. And, we share ideas, we share status of what's going on with the pandemic. We offer each other resources. It's been one of the nice things about this pandemic is really, bringing everybody closer and working closer together.
It's great. Well, we see that even among elected officials. I think it is so true. So someone today who's sick, and the parameters by which someone would get tested today is the same at the St. Elizabeth or even at the statewide, because they set the policy on what parameters someone is permitted to be tested. You have the ability to do that if they reach those parameters, right? In terms of what they're doing, how sick they are, et cetera.
We do, and actually, because we have private testing, we aren't utilizing the state testing. We have the ability to test through Quest, and we also are testing through a lab called Solaris. And we have the ability, we are following the CDC guidelines, which everybody is following. But in addition to that, if our medical provider, through a visit with that patient, deems that the patient should be tested, even though they might not hit all that criteria, our medical provider has it in their discretion to test that patient.
So if somebody today came to you who was let's say they were looking for a primary care physician and they were feeling sick, and then maybe they didn't get tested at this point, but how does that work? Do you then keep up with them on a daily basis to kind of when they're maybe quarantining or staying at home? Do your physicians then call them up, or do the nurses? Is that how that works to keep them under good care?
We do. So it depends on how sick they are when we see them through telehealth. And so if they have been exposed but are asymptomatic, we, typically will tell them if they think they've been exposed to go ahead and quarantine. But if they are showing some symptoms, but mild symptoms, then we'll follow up with them in a few days. We'll also instruct them, we're very clearly, if their condition changes, they need to call. So it's a two-way communication with the patient.
That's, well, and so important, I guess, just being on top of it, communicating what the issues are, and you've got the team there ready to listen to them and help give them good direction. So as we're hopefully eventually going to plateau and come out of this thing, are there any insights that you've garnered over the past week, or maybe things that you're hearing you think, I really wish the community could to know more about what you're seeing on a day-to-day basis? So along those lines, is there anything you'd like to share with the community to say, hey, really take this point home?
I think I read something, and I can't own this. I read it and I can't remember who it came out from, but it was a physician, not at HealthPoint, explaining that, the spread of touching our faces, touching anywhere around your face, it could be on the surface. It's, this is invisible. And so besides wearing masks and, keeping your distance when possible, I think it is important to not touch your face, to just be very cognizant of that, and be aware of that through this pandemic, because that's going to be a key with how we stop the spread.
And do you feel strong? Do you feel like we can come out of this and keep people healthy by being smart about the PPE and things of that nature? Do you think there's a way forward? Do you feel like we can get there?
I do. I think there is a way forward. I think very quickly, especially here in Northern Kentucky, I think all the healthcare organizations learned, very quickly and adapted to what we needed to do, and not just reactive, but thinking days ahead, weeks ahead, months ahead, COVID curve, decline ahead of how we need to protect our employees, protect patients. And I think it will be a long time before things are normal. I think it will be a new normal. I know even when we see the curve coming down, we're still going to do screenings. For healthcare providers, it doesn't just go back to normal, because as long as it's in the community, until we have no cases, until we have a proven vaccine, as healthcare providers, we have to protect our staff and any patients who walk through our door. So I believe we all have protocols in place that now and that will carry forward, that will offer that protection so people can still seek care.
Well, please, accept our appreciation and let your whole team there know that I know the community appreciates what you all do on a daily basis. And as we get out of this, and hopefully the economy opens back up, and we go through this next period before the vaccines are there, we'll take your advice, and we appreciate your giving us some time today.
Thank you. Thanks for having me on.
Bet.